Good afternoon. It was a year ago today where the campaign was launched, 15 days to slow the spread. Well, it's been a very long 15 days. I mean, we still have millions of kids across this country who are denied access to in-person education. We still have businesses closed in many parts of this country, and we have millions and millions of lives destroyed. Those lockdowns have not worked. They've done great damage to our country. We can never let something like this happen again. Florida took a different path. We've had more success as a result. And you see that, of course, in the unemployment figures. We're at 4.8%. You have a lot of these lockdown states that are 8 or 9% unemployment. And even though you look during this most recent period, and they have higher incidence of COVID per capita in places like New York and California over November, December, January period than the state of Florida does. So the policies have not been effective. Florida's policies have been more effective, and yet, with the advent of the federal stimulus bill, we are getting comparatively less money than our population because our unemployment is lower, and a lot of those states that have much higher unemployment are getting much billions and billions of dollars more. I've been on record about saying I don't think that that's fair. Nevertheless, it is what it is, and we have a responsibility to take a look at what Florida may be getting, and I am today going to be sending a letter to the Speaker and the Senate President outlining some of my recommendations about how some of the state funds can be used as part of this most recent stimulus. My recommendations today, we don't know exactly how much money we're going to get. We're going to wait on some guidance. It is tied to unemployment. We think it's between $9 and $10 billion. My recommendations today outline expenditures totaling just $4.1 billion. I know the legislature is going to have a role. I've spoken with both the Senate President and the Speaker. I know they have different ideas, but I think most of what I'll outline today, there'll be broad agreement between both chambers as well as my office. So we propose the recommendations for this portion of it as follows. We know that the pandemic put an awful lot of strain on our first responders, EMTs, sworn law enforcement, firefighters, and so we believe that we should recognize their sacrifice over the last year. So I'm proposing a one-time $1,000 bonus payment to all first responders, fire, sworn law enforcement, EMTs, which totals about $208.4 million. It'll be administered by DEO in partnership with other state agencies, and we want to fund this in this current fiscal year so we can get those payments out as quickly as possible. We also understand there's need to address some of the infrastructure in our own agencies, including the Connect reemployment system. There was recently a report, as many of you know, recommending money to modernize it. So I'm recommending $73.2 million to modernize the Connect reemployment assistance program consistent with those findings. I'm also recommending the provision of $56.6 million to support the operations of the reemployment assistance program to accommodate increased volume and manage the adjudication of claims, particularly when you have disputed claims. An important initiative in my administration, and one that the First Lady has worked tirelessly around, is the coordination and streamlining of behavioral health services. One of the tragic effects of the pandemic is that mental health is the toll on mental health. Social isolation and the stresses of economic uncertainty have exacerbated the need for services throughout our health system, although I will say we've mitigated it much better than some of the lockdown states. But that's why I've included a recommendation of $72 million for the creation of a comprehensive behavioral health management system. This funding would provide for the development of an integrated behavioral health data management system that will streamline access to behavioral health services. The system will have the capability of identifying each individual who's receiving services across multiple systems of care and better integrate those individuals into the services provided across programs and ultimately multiple departments. We want to break down the silos as best we can. We also propose to use some of the resources to help economic development and economic recovery. One of the areas of Florida that's been hardest hit throughout the pandemic has been our seaports. We have 4.8% unemployment, Our cruise ships are under a no sail order from the CDC. I've wanted them to start sailing long ago. I think they should be able to sail, and we want to see them sail. But nevertheless, that's taken an enormous amount of toll on our seaports. And yet, in all these different relief packages, there hasn't been any money set aside for any of the seaports. And so we're recommending almost $260 million in relief for our seaports. That is an amount equal to the losses they've accrued during the pandemic through February of 2021. And obviously, they still will be incurring potentially more losses, but we hope that they're able to get everything operating 100% very soon. We also, as you remember, as part of the budget, I had to make a lot of tough decisions. We were in a time of uncertainty. We didn't know what the revenue would look like, what the jobs would look like months down the road. So I vetoed $1 billion, including some of my own initiatives like the Job Growth Grant Fund. We are, of course, asking for money as part of the normal budget for Job Growth Grant Fund, but I'm also, as part of the supplemental, requesting an additional $150 million for the Florida Job Growth Grant Fund. We believe there'll be ways to apply this to help with workforce skills, as well as infrastructure investments in key areas. And I think it'll be really, really good. So that'll be in addition to what we requested in our normal budget. And the same goes for Visit Florida. We put money in the budget for that. I think we see that there's going to be a need to do it. Now, our hospitality industry has been hit very hard, although they've been able to weather it better than I think initially forecasted, largely because we've been open for business and parts of the state have done very well. Other parts have struggled and are doing better, but are still not close to where they were. So we're recommending an additional $50 million to support Visit Florida operations and marketing efforts. I think that with the advent of these vaccines, you're already seeing people feel really good about traveling again, about doing some of this stuff. There's a lot of pent-up demand, we believe. We think there's a lot of money on the sidelines for people who haven't been doing some of the things they would normally be doing. And we obviously want Florida to be the beneficiary of that when people start getting back into the mix on enjoying themselves, on traveling, on visiting places. And